Hi guys, I'm Panther, and welcome back to Sharp Survivalist. Today we'll go over how to treat a gunshot wound yourself in an emergency situation.
I'm sure you're aware that situations requiring medical attention can be life-threatening. Therefore, every survivalist should make it a point to seek out some formal emergency first aid training.
Alright, so our equipment focus today is going to be the individual first aid kit, also known as the IFAK. This is arguably the best piece of equipment that you can possibly have to treat any kind of gunshot wound on the fly. Listed here are some of the most common items found in an IFAK, but before we go over those in detail, we need to understand what the three primary gunshot wound types are. Type 1 gunshot wounds will be located on the extremities, like the arms and legs. Type 2 gunshot wounds will be in the chest area, and Type 3 wounds will be near the abdomen. And yes, the IFAK can be used to treat all three of these wound types, which is why we 10 out of 10 recommend it to all survivalists and first responders. Alright, so we'll start with a basic treatment overview for Type 1 wounds to the extremities. The number one priority here is to stop any major life-threatening bleeding, namely from arteries that may be hemorrhaging. For those of you that don't know, arteries are responsible for moving large amounts of blood throughout the body. When treating Type 1 wounds, if you see bright red blood squirting out at pulse rate, that is a sign of arterial hemorrhaging. Our primary tools in this case will be our blood stoppers, a tourniquet, and hemostatic gauze, aka combat gauze.
A tourniquet is a hook and loop strap with a tightening rod attached to it. It should be placed as high and tight on the limb as possible. Most modern IFAKs come with a permanent marker, so use it to write a T on the patient's forehead, along with the time that the tourniquet was placed. The next step is to pack the wound tight with a special gauze that is specifically designed to clot blood. Okay, this part can get a little messy, but it has to be. It's super important to keep constant pressure on the wound while you're packing combat gauze so no blood can spill out. Okay, the only thing left to do here is to call 911, watch for signs of shock, and monitor your blood stoppers until help arrives. Our next injury category are chest wounds. Sucking chest wounds and collapsing lungs are the biggest threats to life in these case scenarios. The nasopharyngeal airway, vented chest seal, and chest decompression needles are going to be your primary tools to treat this injury type. Step 1 is to secure an open airway. Your patient is likely to be unconscious or at least struggling to breathe. This is where your nose hose will come in. Make sure to lubricate it and insert it through the right nostril with the bevel facing down. Step 2 is to seal entry wounds using the vented chest seal. It's pretty easy to apply. Simply place it with the adhesive side down, making sure that there are no folds or creases. Next, tilt the patient, keeping the undamaged lung facing up to search for exit wounds and seal them. To treat a collapsed lung, the chest decompression needle should be inserted between the second and third ribs at a 45-degree angle to the chest wall. Once you tape the needle container to the patient, the last thing to do is call 911, watch for signs of shock, and monitor lung activity until help arrives. Moving on to Type 3 wounds to the abdomen, internal bleeding and exposed organs are two of the most common issues arising from this injury type. Your primary treatment tools here are good old-fashioned water and standard gauze wrap. Step 1 is to elevate the legs between a 22 and 30-degree angle in order to mitigate internal bleeding and organ damage. The second step is to pack the wound with gauze tight, but not with too much pressure because that might aggravate the internal organs. If there are exposed organs, never try to push them back into place. Keep the feet elevated and blanket the organs in gauze that is soaked with water. The last thing to do is to call 911, of course, maintain the body's stability, and keep the gauze that is over any exposed organs wet at all times. Keep in mind this lesson was a very basic overview. Check out our website, sharpsurvivalist.com, for more in-depth instructions. Links are in the description. Be sure to like this video and subscribe to our channel to stay up to date with exclusive content. Until next time, Panther, over and out. Thanks for watching.